a warm welcome to our panel once again. All right, so I'm going to call on each panelist individually. What I do, please just go ahead and introduce yourself. You can say a little bit about your background. You can say a little bit about the district that you represent, and any kind of opening remarks that you'd like to add to that. So let's start with Assemblymember Kalra.
Well, thank you so much, Max. It's great to be here in LA. As mentioned, I've been traveling around. Thank you, but look, I get encouraged when I see a room full of activists like this, because I'm just one of you. I'm one of the pieces that we all need to have to make CalCare a reality. And what encourages me is that when I see the district leaders stand up, when I see the activists, when I see the folks from different organizations, none of these organizations is motivated by anything other than love and justice. And that is what encourages me, because we know we're against other motivations, profit and greed, that is going to take a lot of love and justice to overcome, quite frankly. But it's so encouraging to know that there are people in our state, in our community, in LA, in the Bay, that feel so strongly about making healthcare a human right in our state, once and for all. And so I represent San Jose. I grew up there. It's called the capital of Silicon Valley. It's also in many ways the capital of cosmopolitan. We talk about our state as the fourth largest economy in the world. Much of that is driven by the tech sector. And yet we see rampant inequality in my own backyard. During the pandemic, 3 of the zip codes with the highest death rates in the entire area were in my district, in East San Jose, where the workers lived, where they didn't have a choice but to go to work, and most of them didn't have health care. And many of them died. And so, healthcare, not having healthcare access has always been an issue. The pandemic has certainly made it more clear than ever to folks that maybe never didn't think about it as much. Now they see it on the front page, they see it in the news. And so I'm very proud to represent San Jose, where Save Our Child has learned to organize. And it's where we've seen a full transformation from the Valley of Heart's Life, of farmland, to Silicon Valley, at the heart of the tech sector. I was on the city council there for 8 years. Before that, I was a public defender for 11 years. And it was through that experience where I saw my clients, other individuals, impacted individuals in the criminal justice system. I go to the neighborhood, meet with families, and you see how much a lack of health care played a role in their economic tension, in the choices they made. I had a client that once, because he lost health care, his wife was facing life-threatening surgery he didn't have the money for. He robbed the convenience store. He wasn't going to get the money to do it, to pay for the surgery. It was just an act of desperation that never would have happened if he had health care. But, that's the kind of things we're dealing with. These are real people with real trauma. And it's immoral for us to be the fourth largest economy in the world and not provide health care and housing to every single human being in the United States. The last thing I want to say is a couple of thank yous. One to my staff, who's worked incredibly hard over the last couple of years on CalCare. They believe, when I first introduced 1400, I talked to my entire staff, and they unanimously wanted me to do it. And I wouldn't have done it if it wasn't clear for my staff that this meant something to them. That this is what they wanted to invest their time in. And so they put a whole lot of time into it. I also want to thank the nurses, obviously, as a partner in this. I'm so impressed by how many nurses are coming through that work. Every week they still show up to advocate because they believe in something bigger than themselves. And I want to thank my colleagues, particularly my colleagues to the right of me. Senator Santiago, the joint author on 1400, Senator Carrillo was the principal co-author, and they were there and have been there from day one. There was a lot of ups and downs in 1400. I think we made a lot of progress. But both publicly as well as behind closed doors, strategically trying to figure out how we can get more and more of our colleagues on board. They've been there unequivocally, so I want to thank you for that as well.
Assemblymember Carrillo, would you like to introduce yourself next?
Thank you, Max. And good evening to all of you. Thank you so much for all the advocacy that you do, and thank you for organizing this really great much needed town hall. My name is Wendy Carrillo. I proudly represent the 52nd Assembly District, which includes the communities of East Los Angeles, Northeast LA. Some folks call it the Tri-Hipster area of Echo Park, Silver Lake, Highland Park, and now half of Glendale after redistricting. Single payer and healthcare for all is important and critical to me, just simply because of my own family experience. My family immigrated to the United States during El Salvador's 12-year war. My grandmother was a nurse in our home country, and despite El Salvador being this tiny little nation in Central America, it already had universal health care. When we came to the US, my grandmother was not able to continue her practice of being a nurse, so she became a home care worker, and she always encouraged me to get into the field of healthcare and become a nurse or a doctor myself. Sadly, to her dismay, I went into politics. But I know that she would be very proud of the work that we have been doing to advance healthcare for all people across our great state. Specifically, I represent a district that for a long time had been one of the most under-resourced communities in the entire city of Los Angeles. East Los Angeles is a community that is 20% below the national poverty line. Prior to being elected, I was a journalist, and I had a show on Power 106 here in Los Angeles for about 10 years, where I interviewed many activists, many members of labor unions, and folks going through, bankruptcy because of healthcare, and actually holding elected officials accountable for policies that were either creating more hurdles or creating opportunities. And I can share with you, I was a child that was on Medi-Cal. My family was on Medi-Cal when we were trying to figure out, a new life in the United States. And currently, I will share why this is important, why we move this forward. Medi-Cal, you can only qualify if you are 138% below the national poverty line, meaning that if you have a full-time job that pays you $15 an hour, which is now the new minimum wage, you're earning $31,200 a year. That puts you above the threshold for you to even qualify for Medicare. Now, $31,000 a year living in Los Angeles, we know that a large percentage of that is going towards rent, which means that folks are already on the brink of homelessness or being displaced simply because they, one, they can't afford to pay their rent. Two, they certainly can't qualify for the bronze subsidy of Covered California, which already includes an $8,200 a year deductible, which means that you're already on the brink of poverty, but if you made $1 more than the $20,000 maximum that is needed for Medi-Cal, you're already on the brink of filing bankruptcy. We have an opportunity in California to change a system of healthcare that is not working for everyday Angelinos and everyday Californians, and I'm proud to stand in that effort alongside my colleagues, and especially Assemblymember Kalra, who has led the effort for this policy moving forward. And it's about time that we do something different in the state and really show the nation what is possible. Thank you.
Assemblymember Santiago.
Yeah, and thank you for being here at California Nurses Association, all the different organizations that are out there, and all the different activists and leaders who are here. We're extremely proud that you're here, and we're grateful. I want to thank my colleagues too, because everybody knows what a fight it was to get CalCare even introduced last year. We all know this, and if our experience was all the same, there were a number of ads in our districts, there were a number of things that were happening in our districts to try to discourage the movement for single payer. And I think it's important that you understand a little bit of the history of this place too. We're here today at a church, and a church is very important to our district. This is the district that I represent, the 54th Assembly District. And one of the things that happened here during COVID, and I think it's important because it's symbolic of the work that we're doing today in justice work. One of the things that happened here is that there's a food bank. Some of you participated. This food bank was something that I volunteered at on Saturday mornings. So you had a couple of hundred people who used to come here. When the worst of the pandemic hit, those numbers became to increase. And we saw numbers all the way up to about 1,700, 1,800 people showing up. We saw people here showing up and lining up the night before. We ended up having a system to help folks sleep on the curb while we got the food lines ready. We had a system of volunteers that were helping people walk food to their house when they didn't have a car. And so we had hundreds of volunteers here. Food insecurity was an enormous problem within our neighborhood. But I think the other thing that resounded very loudly was that healthcare was also an enormous problem in our district and within the region. And in this area, where you have a high percentage of folks who are undocumented, healthcare is something that is incredibly important. And today, more than ever, we recognize that healthcare is a human right, that we ought to have access to healthcare, and that we can't stop buying until it's done. Now, I was the lead author with our colleagues, so I give them a round of applause, and we weren't successful, but it's moved. It's moved, and this is where we pick up, and this is where we continue to fight. So I want to thank everybody who's here, and I look forward to discussion, and applaud everyone who's here today. Thank you.